All right, Barb, the next thing I wanted to go over with you is how to call a physician consult. Okay. Have you done that yet before?
No, I haven't had the opportunity.
Okay. All right, so calling a new physician consult, you're going to notice here in your work list in Epic that there's a new order for one, okay? The nurse or the doctor can place that into Epic, okay? Now, if you notice here, there is a new consult in here for bed 1978, and the patient's name is Renee Clarkson. If you notice here, she is 62 years old, because sometimes we like to note that because the doctor will ask. It says in here there's a new consult for a GI bleed. Okay, so we're going to call the physician, and here it says Dr. Jones. And if you didn't know, Dr. Jones is a GI physician. Okay, so we're going to call the doctor, and then from there they may ask us like admitting diagnosis, maybe when they came in, like when they were admitted. So it's always good to glance at that information first. So they may ask for that, and we can tell them, or her, because I'm not familiar with Dr. Jones that well, and we can tell them that there is patient was admitted last night through the ER, and that was for weakness, fatigue, and it says new onset GI bleed. Okay? All right. So if we go into iPrivileges, which is in My ProMedica, then we can look up the doctor's phone number. So we go into iPrivileges, type in Dr. Jones, and it says in here that there is an office number and an answering service. Well, we're during the day right now, so we can call the office instead of the answering service. But since you're working nights, you are going to be using the answering service. Okay. All right. So I'm going to do the first consult, walk you through the process, and then maybe the next one you can do. Does that sound good? Okay. All right. So I'm going to call the office, and the number's in there. Hi, this is Toledo Hospital, Adult Intermediate, Stacy, the unit clerk calling, and I have a new consult for Dr. Jones. I was wondering if he or she had a moment to touch base with me about that. Okay. Seeing patients right now, and she'll call me back. Alrighty. Thank you so much. Okay, some things to note. One thing is we're going to write down the time. Okay. So it's 9:30. I'm going to write that down. Do you want a piece of paper to keep yourself organized as well?
Oh, yes, thanks.
Okay, sure. Now there's S-bar pages here that you can use. Sometimes that's helpful to give the information to the nurse as well, like if there's something abnormal or something that you might want to let the nurse know about. It doesn't always have to be for notes, but it could be for some abnormal findings. But in this case, I like to keep myself organized. So I'm going to put on here 9:30, and when Dr. Jones calls me back, then I can cross it off my list. Okay, but we'll kind of wait here. One other thing I wanted to mention to you is before calling the consult, which I had already done before you stepped up to the unit clerk station, was talk to the nurse. And I already talked to Stephanie, the nurse for that patient, and she mentioned that she wants to talk to the physician when they call back. So it's always good to make sure you touch base with the nurse first, because they may have already called the consult or talked to the physician. Okay. All right. And then just another thing to keep in mind, if they do ask for any critical information like labs or reports or anything like that, anything critical we can't give information about. So we would have to get the nurse anyway. Okay. All righty. So we'll kind of just hang out and wait for that physician to give us a call back. All right. Let me get that here. Toledo Hospital, Adult Intermediate. This is Stacy, the unit clerk. How may I help you?
Hi, it's Dr. Jones. You paged.
Oh, yes, Dr. Jones. We were calling you for a new consult. Did the office let you know about that?
They just said you called.
Oh, okay. All right. So let me give you the specifics here. So this patient is a new consult in bed 1978, and the patient's name is Renee Clarkson.
Okay.
Okay. The new consult is for a GI bleed.
Is it new?
Yes, the patient came in last night from the ER, was admitted to our floor, adult intermediate, and the admitting diagnosis was weakness, fatigue, and a GI bleed.
All right. I'll see her tomorrow.
Oh, okay. Well, the nurse was wondering if you would be in today. Is that possible at all?
No, I already rounded.
Oh, I understand. Okay. Let me get the nurse for you, though, because she did want to give you some information about the patient that I couldn't relay.
All right. Hurry up.
I'm going to just put you on hold 1 second to make sure the nurse is available. Okay. You don't want to have them waiting too long, so let me double check with Stephanie. Hi, Stephanie, it's Stacy. I'm just wondering if you're available to talk to Dr. Jones. Okay, I'm going to transfer the doctor into you, okay? Hi, Dr. Jones? Okay, just in case we get disconnected, Stephanie's phone number is 19555, okay? 291, of course.
19555.
Yes,
Got it.
correct. Okay, I'm going to transfer you now to Stephanie. Okay, alrighty. So now that we transfer that information to the nurse, then they're going to touch base on the phone. She'll tell them any additional information. We would want to go back into Epic and complete that on our work list that it's done. All right, so you see how it says document here, or DOC. Okay, we can just click on that. We can fill in the time and the date, and then that will take it off of our work list. And we know the nurse already knows because we're transferring it in. Now, if the nurse didn't want to talk to the physician, we would want to make sure we tell the nurse that they're done.
Okay.
Okay? And we can cross that off our list because it's done.
Yes, done.
Okay? All right, does that make sense?
Yes, it does.
All right.
Thanks for explaining that so well.
You're welcome. So the next one that calls or next one that comes in, physician or phone call or anything like that, you can take care of, okay? And I'll be here to help.
All right.
Okay.
Thanks.